As Minister of VSA, my job is to efficiently and effectively manage the resources of the country to the greatest benefit of the people. And one of my main priorities has been to deliver an accessible, quality, and affordable health care system that is close to home. And the foundation of that starts with a medical center or a new general hospital. The SMMC has served St. Maarten faithfully, but has outlived her functional lifespan. The staff and specialists deserve to be recognized and commended for their continued commitment and dedication, even under very difficult circumstances. Today, we've reached an important milestone in the development of a new St. Maarten General Hospital, a milestone that was reached not in isolation or in secrecy, but a milestone that has been reached in an environment of openness, transparency, collaboration, and partnership. The tripartite committee comprises of representatives from the SZV, SMMC, and from the Ministry of VSA, who have all worked tirelessly to guide the project to where it is today. And I believe at this stage it's important to recognize that this is very much a team effort, and that we need to acknowledge the support and efforts from not only the members in the committee, but also the board, management, and staff of SZV, the board, management, and staff of the SMMC, as well as the Ministry of VSA. And I would like to express my most sincere appreciation and gratitude for everybody's collective effort. And it is this inclusive process that will ensure that this hospital project will become a reality. A hospital that is modern, affordable, practical, and efficient, all to better serve the people. The new St. Maarten General Hospital will increase the range of specialists and services that are available locally, will reduce the amount of patients that we need to refer abroad, allowing our people to be treated at home, which clearly improves patients' recovery times, and to incorporate modern and efficient technologies into the new hospital. At this point, I'm going to go into some of the elements of the press release which has been handed out to the media. So today what we are actually announcing is the tender evaluations for the new General Hospital for St. Maarten. Contract negotiations for the design, build, and maintenance contract of the new General Hospital of St. Maarten will commence this month with the nominated bidder, INSO. The construction of the new General Hospital is scheduled to start in the third quarter of this year, provided that all the financing terms and all the contract negotiations complete as we expect. 3 bids were received last month for the construction of the new hospital. These bids were received from Baum Phillips, INSO, and VAMED. INSO is selected for contract negotiations based on the unanimous outcome of 5 independent evaluation teams which reviewed the 3 bids based on the main criteria, which include price, quality, timing, local involvement, and financing. INSO scored high on price for design, building, maintenance costs, quality, timing, and local involvement. INSO came out with the best overall ranking, a final score of 165.4 out of 200 points. INSO is an international company based in Italy with extensive experience in the construction of hospitals globally and regionally within the Caribbean. Baum Phillips submitted a price of $138,943,852. VAMED submitted a bid of $80,149,443. And INSO submitted a bid of $59,578,655. The contract value will be based on the bid of INSO, which includes the building of the new General Hospital and state-of-the-art medical equipment. The contract negotiation phase with INSO will address the conditions and financing of the project as well. There are 3 financing options, 1 via the contractor, 2 via the government of St. Maarten, and 3 via SZV. Financing via the contractor has been evaluated to be the least attractive of the 3 options. The option via the government saves millions of dollars several million dollars, and is clearly the preference to have St. Maarten own the general hospital. Government is working diligently on finalizing this financing. But to avoid delays in the project, SZV will be instrumental in providing the required financing. This will create a favorable return of investment of 5% for SZV and a much higher return than the current return on investment of its investment portfolios. So according to our project schedule, the next milestone in the contract will be the contract closing on August 30th, 2016, and upon finalizing of the contract, the construction of the hospital would start as of next month, and the new general hospital is scheduled to be operational by the middle of 2019. But in addition to providing St. Maarten with a quantum leap forward in improving the quality of health care for our population, the new hospital will do much more than that. The new hospital will also create local construction jobs, and it will create 73 additional new jobs for the hospital, not even including medical specialists. It will secure St. Maarten's position as a regional hub, not only from a tourism perspective, but also as a medical center of excellence that will serve the neighboring islands, including Saba and Statia, and it will serve to finally diversify our economy. And by reducing referrals abroad, we are ensuring that more money will circulate in our local economy. Thank you very much.
Well, thank you very much, Minister Lee. The smile on my good friend, the director of the Sint Maarten Medical Center, Mr. Kees Klarenbeek, I have seen it grow bigger and bigger the last couple of weeks and months, and today it's even growing more, because finally what has been promised to his staff for many, many years is seemingly becoming a reality. Kees?
Thank you, Glen, and I'm smiling indeed. Good afternoon, everyone. First of all, it's a great pleasure to be here today to inform you about the status of the process for getting a new hospital for Sint Maarten, for surrounding islands, and the tourists. I like to emphasize the importance of the tripartite, a collaboration between the Ministry of VSA, SZV, and SMMC. Working together and stepping over the boundaries of their own entities makes it possible to develop hospital care on Sint Maarten, including a new hospital. A new approach what benefits the citizens of Sint Maarten and surrounding islands by getting step by step better quality care and more services available. A new hospital is a huge step forward in quality care and accessibility of care. The existing hospital is too small and not functional anymore regarding the vision on modern healthcare nowadays. Furthermore, the SMMC building is old and expensive to maintain. The staff, medical specialists, nurses, and supporting staff give every day again all they have to keep the hospital and the hospital building under these circumstances running. We are very thankful for those efforts. Yes, we looked forward to this moment for a long, long time to make it possible with a new modern building to serve the care needs of the population better. Better than we can do now with our own existing building. We are grateful that we reached this point where we stand today. And I'd like to use this moment to say thank you. Thank you to all who were working together to reach this point. The new hospital offers all opportunities for further improving quality care and increasing the number of specialties within the existing building. New specialties as neurology, ophthalmology, urology, and orthopedics. Of course, those expansions will follow the demand of care. This because the hospital is not there for itself, but only for fulfilling the care needs of the populations of Sint Maarten, Statia, Saba, surrounding islands, and tourists. The new hospital will have sophisticated equipment installed, like telemedicine opportunities, an MRI scan, magnetic resonance imaging scan, a cath lab for cardiac and vascular intervention, and operation rooms for all kinds of different surgeries, including orthopedic surgery. Again, all care demand driven. For growth of existing specialties, for introduction of new specialties and new medical equipment, employees in service should be properly educated and trained in time. And of course, new employees should be hired. Training and education counts for all: medical specialists, nurses, supporting staff, technicians, etc., etc. Also, numerous other challenges will be there. We acknowledge this. We acknowledge this in an early stage and are in the process of finalizing the transition plan to be fully ready to move to the new hospital when that moment is finally there. But again, as mentioned before, the hospital is there and will only be there to serve the needs for care of the population. We try to deliver as much care as possible locally, also in collaboration with the hospital at the French side and hospitals within the kingdom. Organizing the care, not far away without family and friends around you, but providing care close to home, with your loved ones nearby and with the lowest level of discomfort possible. The new hospital will be a very, very safe building, what will be able to sustain powerful hurricanes and heavy earthquakes. It will be based on the design of healing environment for patients and will be a healthy workplace for its staff. A huge step on our way to get the new hospital built is made, but a lot of steps has to be followed before we can move into the new structure. SMC, together with the tripartite, her staff and her supervisory council, will make those steps with great pleasure. We are fully confident that we will deliver every day better and better quality care, and what becomes more and more accessible to all citizens of Sint Maarten, Stasia, Seba, surrounding islands, and our tourists. And this new hospital is hereby an absolute necessity for the coming decades to accomplish our mission.
Thank you very much, Kees. Well, I think my colleagues speaking before me made it perfectly clear the importance of this project we have embarked on. But why is the SZV so excited with this project? Why are we so much involved? Because it means a lot for our customers. It means a lot for the patients, not only for those staying at home and treated in the Sint Maarten Medical Center, but especially for those going abroad. It's a public secret that most of you in the media have written reports of issues, of complaints we've had of some of our customers going abroad. But just imagine, no more travel issues, no more issues with lodging, no more problems with daily allowance not being transferred in time for patients that have to stay longer abroad. Less immigration issues or no immigration issues. Language and cultural barriers will disappear. Easy for the family that have to visit their loved ones when they're being treated in the new Sint Maarten General Hospital. Just imagine that. And that already will be an improvement for the customers of the SZV. And that's why we are so excited to get this off the ground. I would like to continue with the Prime Minister, Mr. William Marlin.
Thank you. Thank you, Glen, and good afternoon to all, and a special good afternoon to our visitors and to my colleague, the Minister of Public Health. There's very little, if anything, actually to add to all that have been said, and I don't want to, really repeat, but congratulations are definitely in order and in place. And today, reaching this milestone is truly what is celebration. Not only a celebration for the minister who has dug into this project from the very beginning, which was one of the several priorities for this government upon taking office several months ago. But also an important milestone for the Sint Maarten Medical Center, for the employees, for the SZV. The director, Mr. Glen Carty, just pointed out the benefits for the people, but it's also a macroeconomically benefit for the country. The savings will be tremendous in terms of health care, because no longer would SZV have to write huge checks to send abroad, but that money will be used for improving of our healthcare and bringing down the cost of healthcare. We have had seniors complain over the past years that their insurance, their medical insurance is practically, well, not practically, but doesn't give them much of what they need, because SZV has to ensure that it doesn't run into bankruptcy and can continue to pay for medical care and medical expenses for our people. So the savings that we would derive from the effects of having a state-of-the-art general hospital in Sint Maarten can now translate into more vitamins for our seniors, more health care for our seniors, and more benefits from your SZV card, because we would have more savings in general. So I want to say again, because you cannot emphasize it sufficiently, the congratulations that are in order. We know that there are those monitoring the development and will tomorrow, if not already this afternoon, start to announce that they had plans already, and what this government is doing is what they were planning to do or what they were ready to do. But after some have been in office for 1 year, having not been able to just produce more than pictures and tell you that they were ready to do things, and spend an entire year in office and have not been able to accomplish anything, this government is putting action where promises have been made. Yes, we can't do everything that everyone expects in 9 months, but we have been able to accomplish quite some, which others were unable to do in many years. It might sound like the press briefing is taking on a political tone, but be it what it is, we are in an election period. Postulation day is on Monday, and I'm sure that others, when they launch their campaign, and we are not launching any campaign here, but I'm just telling you the facts that you will be faced with in the coming days, to try and make it look like, oh, what the minister has done, we were doing it already. What the minister and his team has been able to, the minister has been able to accomplish is totally different from what others had set out to do. The minister made sure that there was a public bid, it was transparent, and if we look at what others were planning to do and what this government will achieve, and the savings that will be passed on, not only from the savings from referrals abroad, but from the upfront savings in terms of the investments that will be made. So, Minister, congratulations for a job well done. I said earlier, no alcohol in the government building, so we can't pop the champagne here, but we will definitely break open a couple of glasses or bottles of water. And remember to recycle the empty bottles as well on your way down. Drop them in the bin so that we can all have a pleasant memory of today. Glen, congrats. I know you have moved your headquarters into the government building, serving every ministry and every minister, doing whatever it needs to get things done to move Sint Maarten forward. The director, congratulations, and to you also for the support that you have lent. And we often forget, you know, the other people in the back of us, but wherever there are successful ministers and successful governments, there are successful staff that support them in moving their agenda forward. Thank you all for coming, and have a blessed Sunday afternoon.
Let me start with a question about the location of the hospital. I didn't find it anywhere here. Is it going to be near
The location will be the exact same location surrounding of the present Sint Maarten Medical Center case. Perhaps you would like to go more in depth, but it's the same location as the present Sint Maarten Medical Center.
Yeah, it's the same location as mentioned by Glen. There's a big spot behind the hospital by Link 1, where a lot of cars are parked normally. That's the spot where the building should arise.
Okay, another question is about the two remaining finance options. Is SZV now going to finance it, or are you first going to see whether the CFT will approve the loan?
I'd like to pass that question to Mr. Henk de Zeeuw from KPMG, who is the consultant that the tripartite has hired in to guide us through this process.
Well, the process is, as already a little bit explained, the preference is going via the government financing.
Because it's cheaper.
That is cheaper and has more, let's say, benefits for the project. Government is working on that. That will take some time, but that process looks very good. It's a very good cooperation with CFT. But in the meantime, we will start up the process, and SZV, if that is necessary, will help us with the financing. But the idea is that we would like to go to the preferred solution.
Oh yeah, so but you're not waiting for the decision on the ideal route.
While we're working in parallel,
cool.
we go along.
Yeah. Then I have a question about the bids. There is an enormous difference between the highest and the lowest bid. What's the explanation for that?
Again, I'd like to pass the floor
Did we get
Mr.
golden taps or something with that high bid, or?
Mr. de Zeeuw?
It's always very difficult to pinpoint exactly what it is, but indeed, there's a big difference. They all get the same packets of information. We have sent out the tender instructions with all the technical details and functional requirements. And you have to remember that this is a very complicated building. We asked them, based on the functional requirements which we have made together in the tripartite and people from, in particular from the hospital, what do we need and so on and so forth. And that means that each and every party has to come up with their ideas, their translation of what they think is the best fit based on the functional requirements.
Yeah.
And as a result, some people think it should be more luxury, it should be more this, it should be more that, and so on and so forth. It's as well for the technical specs. And we said it should be Hurricane Proof 5 for Hurricane 5 and so on and so forth. Well, different companies have different solutions. And we have seen in the evaluations that there's quite some differences between how they, let's say, designed that building and what it means for, let's say, in particular, the finishing and the way they built up the structure.
Yeah.
So the difference is in various options, but the whole idea is they have to come up with a concept, and the concept is different, the price will be different.
Yeah, well, but the difference of $80 million seemed absurd to me.
It is absurd, but again, you have to understand that there is a different in concept, and you have seen perhaps the pictures that is Inzo. That building looks different than the building of BAM, right? So it's not really apples and pears. And what we did, and it was mentioned by the evaluation in the five groups, as well the technical, we really drilled down to see the differences, whereby we focused which company will comply with all our requirements for the best terms and conditions in general, right? That's what we did in the end of the day.
Okay, so now we're looking at a price of, say, $60 million. Is that number written in stone, or are we going to find out in 2018 that it's actually 70, 80, or 90 million?
The project, while we did the tender, let's say, instruction, it is clearly stated. We're using a standard contract. They also have reviewed the contract already, the three bidders. It's a standard FIDIC gold contract, and it means that it will be a turnkey project. So it's basically a fixed price. A fixed price doesn't give you 100% guarantee, but it gives you the best guarantee that you will stay close in the budget. The reason why it could be more is that while you're doing the construction, you want to add something.
Yeah.
That's up to, let's say, to the hospital and the two other parties in the tripartite. So it's not likely that we will have a budget overrun, although we are now discussing. We also had the idea of having an additional wing. We might put that in for right now, but that is something we will discuss in the coming months. But
Yeah, yeah.
the
Okay.
idea of having budget overruns based on the, let's say, the concept of the contract, and is the way that we have, let's say, set up the control. We have hired an international cost and quality consultant to be sure that they will deliver the quality and the
Yeah.
quantity according to the specs.
Okay. Then I have a question about INSO. We talk about rumors on the street. Somebody just said, oh, Corallo is behind that company.
I know absolutely nothing about it.
No, me neither, but
Yeah.
you said ask those questions.
Yeah.
Yeah.
I have absolutely nothing, information or nothing like that. What we do is when we choose the companies that are going to bid, they send us all the information on that. We do background checks to where we can, but absolutely no information on that.
Okay, thank you. Now, one last question.
Sorry, I
Minister
think it's
Lee.
also important to mention that, originally we received 12, when we put the project out, there were 12 parties that were interested in bidding for the project, and there was a pre-selection process, and that group was narrowed down to 5. And so there was already a whole due diligence process that went through with each of the bidders, because it made no sense to ask them to invest the amount of time and energy that they've put into this, only to later on find that for some reason they would be disqualified from
Yeah,
the
yeah.
process. So that whole vetting process was done from, not only from an ethics perspective, but from a financial perspective, from a historical perspective, relative work, what projects they've completed. So all of that evaluation was done, and that's how the 12 were narrowed down to the 5.
Okay, one last question, Minister Lee. Somewhere in the press release, you talk about this Rust decision that you found on your desk when you took office. Could you give us some more details about that one?
If you recall, and actually Prime Minister could probably help me out here a little bit, but when with the change in government, there was a decision that the current sitting government should be a caretaker government. In that time frame, the government was not to take decisions of let's say, a binding, significant nature. When we came into office, there was a decision to award the contract to an Austrian company without any bidding process, with a maximum budget price of over $100 million.